So the most common type of imaging modalities in medicine are X-ray, diagnostic ultrasound, MRI, CT scans. These are all imaging modalities that we utilize as physicians in addition to our physical exam to make a diagnosis and a treatment plan. Diagnostic musculoskeletal ultrasound is the use of an ultrasound machine to look through the skin at the soft tissues underlying and helps me as a physician diagnose various musculoskeletal conditions. It gives me the ability to essentially look through the skin at the anatomy and the injured area and actually make a more accurate diagnosis in addition to the physical exam. One of the beauties about musculoskeletal ultrasound is that I can use that at the point of care during the appointment to evaluate the patient as an extension of my musculoskeletal exam. I'm able to dynamically interact with the patient and stress the injured area or the painful area and confirm that that is the painful structure and or injured structure and how severe that injury may be by looking directly at it through the skin. This is something that you cannot do with other imaging modalities very easily. These other imaging modalities, including X-ray, CT, and MRI, are static imaging, and this means that the patient is in a still position throughout the imaging course. However, with musculoskeletal ultrasound, we can dynamically look at the tissues and stress the area and video those things to see how the tissues are behaving in the setting of an injury or a painful process. Another great advantage of RMSK ultrasound is that it is exponentially cheaper than most other imaging modalities. This oftentimes is able to save a patient getting a more expensive imaging test that may not be necessary. However, I do think it is very important to understand that other imaging modalities certainly serve a role, and we oftentimes will obtain MRI and or CT scan prior to a surgical intervention if that's warranted based off the diagnosis with the ultrasound.